Welcome everyone to the July 28th Indiana Coalition Network webinar. We're excited to have CareSource here with us. If you see on your screen, you'll see Gail Smith. She is the Behavioral Health Initiative Lead from Northern Indiana. She obtained her master's in social work from Indiana University, Purdue University at Indianapolis in 2001, and a licensed social work with a certified case manager. She has been in managed care since 2007 and has worked in utilization management, case management, and transitions of care through other MCOs in Indiana. Emma Dartis, she is the Behavioral Health Initiative Lead, Indiana Market. She has been employed at CareSource for 5 years, where she is currently one of 3 behavioral health initiative leads in the Indiana market. As a behavioral health initiative lead, Emma is responsible to provide support on the operational, clinical, and provider levels to ensure CareSource's behavioral health quality, compliance, business, and advocacy goals are met. Then you also can see Angie Summers. She's waving there. She has over 20 years of experience as a clinical nursing. The majority of her time was spent coordinating and managing clinical trials in patients with rare blood disorders. And she is the school-based health administrator at CareSource. And then you have Brittany Bertraw, and she is the Behavioral Health Initiative Lead for Southern Indiana. Brittany started at CareSource in 2017 as a care manager and joined the Indiana Behavioral Health team in 2020. Before coming to CareSource, she had experience in homelessness prevention, psychiatric residential treatment, and outpatient mental health counseling. Brittany is a licensed clinical social worker and is trained in trauma-focused cognitive behavioral therapy, child-adult relationships enhancements, and is youth mental health first aid instructor. Jessica Johnson is the behavioral health and wellness for CareSource Enterprises, and she is a licensed professional clinical counselor and licensed independent chemical dependence counselor. She obtained her bachelor's degree in psychology from the University of Cincinnati and a master's degree in clinical mental health counseling from Xavier University. Jessica is a manager of behavioral health and wellness for the enterprise with CareSource, where she collaborates with healthcare systems across markets to ensure the structure of behavioral health ecosystem is accessible and adequate for members in need of care and driving from best practice models. Welcome. We are very excited to have you all. Thank you.
Thank you so much. We're really excited to be here.
And I will turn it over to you guys now.
Okay, well, yeah, so thank you. We are excited to share a little bit about CareSource and what we have to offer and how we might be able to support some of the goals that exist within your coalitions. So let me share my screen here. And so before we do get started, I wanted to share a little bit about CareSource. And so we are a nonprofit managed care entity here in the state of Indiana, and we've been around since 1989, but we've been in Indiana since 2016. And so we currently serve over 2 million members in Arkansas, Georgia, Kentucky, Ohio, West Virginia, and Indiana. So for Indiana specifically, we offer the Healthy Indiana Plan, or HIP, Hoosier HealthWise. We also offer marketplace plans and D-SNP health plans. And our mission is to make a lasting difference in our members' lives by improving their health and well-being. So today we'll present on the topic of substance use disorder harm reduction, and we hope to have a conversation about strategies and programs to reduce the negative effects of substance use on individuals who use substances, but also the communities where they live. And so we're going to provide national and state-specific data about substance use and overdoses, and we'll also share information about services CareSource offers, and again, how CareSource can support your coalition's goals and priorities, particularly when it comes to combating substance use disorder and promoting safety, health, and wellness in your community. So at this time, I'm going to turn it over to Jessica so she can get us started with sharing the data.
Thanks, Brittany. So I just want to thank everyone who participated in the pre-survey that we sent out in advance. We were able to incorporate some of the responses that we received throughout our presentation today. And so one of the questions that we had inquired on was which substances you're seeing the most in your county. This was a multi-selection opportunity, so we did see a lot of consistencies across the respondents. Of course, opioids, methamphetamines, and alcohol rose to the top, kind of as expected, similarly to the national data. But we thought it interesting to call out that each and every participant in the survey did indicate that marijuana was one of the substances that was utilized as well. So although a lot of the responses we received were across the state of Indiana, a lot of the similar trends were present and are reflective of the national kind of trends that we're seeing overall. So Brittany, if you transition to the next slide, I do want to start our conversation today just speaking a little bit about what some of that data does look like nationally, a little bit, of course, in Indiana, and then to drill down to what we are seeing as well. And so I think everyone on the call here is aware of the opioid epidemic, the taxing toll it's taking on the communities and the providers and families and the members in our communities every day. We hear a lot about fentanyl. We hear a lot about overdoses, but I just want to call to attention everyone that alcohol is still very, very relevant. And based off of your responses, it's very clear that you see that as well. And unfortunately, we see over 95,000 individuals who pass away due to alcohol use disorder or alcohol-related events each year. So we know that that is still alive, unfortunately, and we do still have a lot of support that we need in that area. But we do see some preliminary data from the CDC. I'm sure you all have seen some of this, but from November of 2020 to November of 2021, they're actually indicating that 12-month period as being the deadliest year, which unfortunately keeps increasing. Right now, they're looking at over 107,000 individuals who have passed away in that time frame. Their preliminary intuition behind that is really based off of fentanyl increasing, which you'll see at the bottom of the screen is a factor in more than half of the overdose deaths. So Brittany, if you can transition to the next slide, I do want to call attention to what some of those deadliest substances are. And I think we all recognize fentanyl being at the top. We do still see heroin there, but if you'll see, alcohol is at the top as well. Around 10% of the recreational drug toxicity reports are coming back with alcohol being a contributing factor. And oftentimes, I think there are some other medications and other substances folks use that often get overlooked, such as GHB, which is like a liquid ecstasy, a designer drug as well. So there's a lot of complicating factors in what we're noticing in toxicology reports. And we know the lag behind those to get us accurate data in real time to be able to reflect upon some services in the community, which you all are working through. I want to transition to the next slide to look specifically at Indiana before we dig into what are some of the services that we offer and some responses in the continuum of care that we can contribute toward. Just to highlight, in Indiana, of course, in 2022, the data reflects almost 1,700 individuals who had passed away due to opioid overdoses that year. And so although we know that this is increasing, we did recognize that it increased about 4.5% over the past 3 years, which is similar to increases across the national landscape. But what we noticed with Indiana, unfortunately, is that this is around 28.5% above the national average. So the work that you all are doing is very, very relevant. The focuses that you all are contributing to the community is very important. And so we want to find ways to enhance and collaborate to support the work that's already established and the directions you all are heading with your goals. If you go on to the next slide, Brittany's going to share a little bit more about the continuum of care and the services that we offer as benefits.
Thank you. And so we know that treatment works, and we fully believe that our members need access to the robust continuum of care. And we also recognize they need access to adequate and timely treatment, because the sooner that we can intervene, the better the outcomes should be, ideally. We do recognize that there are exits and entries into the continuum at multiple points. And so we really do try and support the entire continuum and a continuum of providers that foster retention and services. So we come alongside our providers to assist members or their patients in identifying and accessing services wherever they may enter the continuum. And then we continue to support our providers with care coordination and helping their patients or our members transition between levels of care. And we recognize that there is evidently or can be relapse when it comes to substance use disorder, and we expect challenges. So not only do we support providers, but we also support our members by helping them get back on track. We can connect them to several of our services, which will be discussed later in the presentation, but we do encourage a path to recovery that fits their individual needs. We recognize that recovery looks different to each individual, and really having the resources and available supports in the community at any point of the continuum, we recognize that this is key to helping our members on a safer path to recovery. So I wanted to go back to that pre-survey and talk a little bit about your responses. So this question was particularly about the gaps in SUD services in your communities. And the largest gap identified was with 4.0, or inpatient and withdrawal management level of care. And then second behind that was outpatient services, which included medication-assisted treatment. And so we will talk a little bit later in today's presentation about our community learning collaboratives. These are forums that we host that bring providers and key stakeholders together, and we utilize data similar to what we're talking about today to have a conversation and solution through gaps in care. So the results on this slide, well, I'm sorry, I did not include, I had additional question in the survey. This is about gaps on the continuum, but there was also a question about other gaps in services identified. And so those were things like housing, prevention and harm reduction services, and peer recovery. So we did want to offer additional resources, but right now I want to highlight a few, especially with housing being one of the larger gaps and peer supports. So DMHA, switch here and pull up my screen, but DMHA, the Department of Mental Health and Addiction, they offer a housing locator, and I will share the link in the chat, but this is where we could really support our providers with helping locate services. In particular, there are some recovery housing options that are listed here, and this is, you can search this statewide. And so if you're working with somebody that lives in another county or that needs to go to another county, this is a good resource to utilize. Another resource, in case you all aren't aware, is the Indiana Recovery Network, and they've newly added some support services. They've always offered peer support, but now they have offered some assistance with transportation to activities that support a person's recovery. And so if peers are working with a particular member, they can assist them with getting transportation that might not be covered by their Medicaid benefit, and that they can be accessed by calling 211. So I am sure that you all are familiar with these resources, but we always like to highlight them and remind providers and partners that we work with of their availability. So another pre-survey result, these were questions 9 and 10. It was about barriers to accessing services, but then also solutions that you all have tried to counter these barriers. And so aside from the gaps in the continuum that were mentioned on the previous slide, some of the biggest barriers were related to stigma, knowledge of services that are available, lack of support, and then elected officials were also identified. Stigma, though, that was overwhelmingly listed as a barrier. And I think it's pretty common within this space, and it really just speaks to the need for ongoing education and support for communities statewide. That being said, if you look at question 10 and the responses there, a majority of respondents indicated that education is used as a strategy to counter barriers. So we do agree with that. Additional responses were about soliciting agencies outside of one's county to bring services to their county, offering naloxone to all patients. And then this last response I thought was really creative, but as a way of reducing stigma, to tell an individual that, you don't have to tell anybody who the naloxone's for. You can say it's for a friend, as a way of maybe reducing that stigma, but encouraging access to that life-saving antidote. And so Now I will transition to how we work with communities to really increase education and supports across the state, which ultimately improves outcomes for our members or citizens of Indiana. So this slide really just speaks to some of the ways that we partner to address mental health and substance use disorders. And so we have a strong commitment to our providers and community partners. Our members live statewide, and so we are always looking for innovative ways to improve services and supports available to our members and that are offered by our provider network. And we really want to work with you to support your community's goals. So just to highlight, some of the things that we do, we work alongside with existing structures, and we try and build communication between entities. So we try and facilitate a link between providers who are offering similar services or who can provide maybe those companion supports. And then we advocate for increased services across the state. And so over the next couple slides, we'll talk about some of our specific initiatives and ways that we support our members as well as community partners, and some strategies that we've implemented to reduce harm and improve community well-being. So at this time, I will turn it back over to Jessica so she could speak a little bit more about these efforts.
Thanks, Brittany. So one of the key areas in increasing awareness and access, of course, is getting accurate information out into the community. And so we focus on SUD harm and risk reduction, which is also something that was indicated in the pre-survey results as being a gap in the continuum or additional services. And so we try to share the information with as many individuals as possible, whether that's providers, stakeholders, or members directly, and essentially getting information out there around the additional benefits to SUD harm and risk reduction, statistics around the efficacy behind that, and specifically calling out the component of naloxone given the opioid epidemic. And Brittany, if you'll go on to the next slide, I just wanted to share a little bit about what that looks like from our lens at CareSource. So we do offer naloxone as a covered pharmacy benefit for every single member, whether it's Medicaid or Marketplace. They do not have to have a qualifying diagnosis to access this benefit. They do not have to have an accompanying opioid prescription to access this benefit. We know naloxone cannot be self-administered, so it's very important that the access does not have any kind of barrier as to who can access this medication in general. And so we really encourage family members, friends, significant others, any individual who might be at a heightened, might be in a situation where an individual has heightened risk for opioid overdose. And so we do have a picture here and a little bit of explanation around what our Indiana benefit is for naloxone through our pharmacy. If you'll go on to the next slide, Brittany, I just want to share a little bit about the data that we have access to. And from Brittany's previous conversation about working with communities, one of the things that we also offer is from our viewpoint and claims data. And sometimes it's helpful to paint a broader picture or to kind of fill some of those gaps in the continuum to be able to identify where there could be some improvements or supports in the community. So here I'm just sharing a little bit of data based off of our 2021 pharmacy claims compared to our medical claims, of course. And so from January to December in 2021, what we recognize is that between Medicaid and Marketplace combined, we had a little bit over, I guess kind of close to 1,800 naloxone fill counts. So what we're able to see is of those that are filled, were they distinct members? Were there duplications throughout that time period that they filled it multiple times? Did that individual have an SUD claim that identified that they had an SUD diagnosis during that time period? Just to kind of paint a broader picture for us to better understand who's actually utilizing this benefit. We know there are lots of other opportunities that individuals access naloxone through, whether it's grant funding or harm reduction organizations. So we know this isn't a perfect comprehensive picture, but it does provide some insight. So some of the things that we can take away just from last year across Indiana was that more individuals fill naloxone scripts in Medicaid than Marketplace. We also have more, not very much significant, but more individuals are getting more than one fill. And we also noticed that majority of those individuals have an SUD claim, which can help us identify some of the gaps for providers or community organizations to tailor some of their outreach and awareness campaigns to ensure that they're approaching the appropriate providers or appropriate stakeholders. So if you go on to the next slide, Brittany, I just want to share some additional things that we do to create additional awareness and access. Of course, we utilize social media. And so we do have some annual campaigns that go out twice a year, just really around some of those heightened risk periods. We also utilize a member newsletter for all of our members to include the awareness and help combat stigma around SUD, accessing care, and naloxone in general. And if you'll go on to the next slide, Brittany, I also want to share with you all another type of harm reduction effort that we have going besides just naloxone. So we know that there can be additional medications in the home. We want to prevent misuse when possible. And we know that individuals struggle with transportation, accessing medication disposal locations. And so ways that we have increased access to medication disposal packets has been through online ordering. So through our CareSource website, this slide deck, when it's sent out, the little purple link right there is a hyperlink where you can go straight to our website. But essentially, individuals can get, any of our members can get on our website. They can put in their address they would like this medication disposal packets to be mailed to. We do request that they indicate how many medications they want to dispose of to help us inform how many packets we should send them. And then, of course, we do ask if it is in relation to an opioid. And that's really just for our tracking and better understanding, not that we wouldn't provide it to them if it wasn't an opioid. But this is an unlimited benefit, and it is free to the individual that requests it. So this medication packet gets mailed to their home. They can dump the packet in their medication bottle, add some warm water, shake it up, and it becomes a solid, which deactivates the medication so they can safely dispose of it in their trash can at home. There is no limit to how many they can access, and they can go back and access more thereafter. We also have initiated some specific initiatives with our care management. So whenever they are going through medication reconciliation processes with our members, they can also offer this disposal packets to them as well. And they can also support the ordering of those. And lastly, I'll just mention that we also have a specific initiative around individuals who have received an opioid medication for the first time in 12 months. If they do not receive a refill, we go ahead and send a letter and the packets to them with the idea that they may have a few extra medications left over that they do want to dispose of. So we're really trying to offer access and awareness to this through multiple different forms, including those community learning collaboratives that Brittany had spoke about before. And the final thing that I want to share with you all is that Angie will be sharing on the next slide a little bit of information about how we collaborate with additional harm reduction programs in the community to ensure access to harm reduction services.
Thank you, Jessica. I'm excited to talk about this new program in which CareSource has partnered with Overdose Lifeline to implement an emergency response program in Indiana schools. The focus of the project is primarily on emergency preparedness training for schools in the event of an opioid emergency. Overdose Lifeline will offer emergency access medication boxes to the schools that contain naloxone kits. Those are kept in the nurse's office or clinic in case of an opioid overdose emergency. High schools will receive one emergency access box containing 2 naloxone kits after all completed training has been completed for necessary personnel. The naloxone itself has been funded through a grant from the governor's office and the Department of Mental Health and Addiction. Now we'll go back to Brittany to share some additional resources.
Thank you. And I'll be quick here, but just wanted to highlight some of the various resources that we recognize for SUD treatment and supports. So there's resources for accessing naloxone, so Overdose Lifeline, as we've mentioned. There's also Ship Happens, and they do direct mailing of naloxone across the state. And then there are additional harm reduction resources. So some are national and some are state specific. So as you can see, SAMHSA, Indiana Department of Health, Mental Health America of Indiana. And I will just say these are all live links. So if you do receive a copy of the PowerPoint, we will send it to Kimbra. They can be accessed just by clicking the links within the slide deck. And so at this time, I'll turn it back to Emma so she can share a little bit about CareSource and resources, or CareSource programs and resources that we offer to our members.
Great, thank you, Brittany. As this bar graph illustrates, the results from the pre-survey indicated that 3 out of 11 respondents, or 27% of you, felt as though you had a good or very good understanding of how managed care can support members or individuals on the SUD continuum. In addition to the examples previously stated, CareSource has multiple other programs that can support individuals while in recovery. We'd like to offer an open invite to you all and others for more direct and intentional conversations on these areas, Ottawa County specific meetings with CareSource or regional community learning collaboratives based on identified topics you have. We can support your community through partnership, additional care management support, data for a broader picture of a member's journey, technical assistance, social determinants of health resources, and more. Next slide, please. So as you can see here, CareSource has a myriad of programs that help support our members in the community, such as our behavioral health crisis line, addictions line, our 24-hour nurse line, as well as My Health, which is an online platform that allows our members to have access to tips, suggestions, lots of information on behavioral health conditions, medications, tobacco cessation programs, daily mood tracker, as well as inspirational quotes. These resources are available to our members at no cost, and the rest of these programs will be highlighted in the upcoming slides. Next slide, please. So this diagram here illustrates that CareSource has an integrated care management team, and the model of our care management team is patterned after the integrated care delivery system. Case managers work on behalf of and with our members to establish an interdisciplinary care team. And this interdisciplinary care team includes representatives from a wide array of services and healthcare disciplines based on the individual member's needs and preferences. This collective group would include obviously the member, their family or caregivers, case managers, specialty care professionals, all focusing on supporting the member's health and wellness goals and supporting the member's self-management of their conditions. I would like to highlight that our care management program is not to replace the case management program they are receiving through their local community mental health center, but to supplement, come alongside. So we can assist with care coordination efforts, such as locating participating providers. Next slide, please. So here, I'd just like to briefly review the Indiana Pregnancy Promise Program. It is a free voluntary program for our pregnant Medicaid members who are currently using opioids or have used opioids in the past. Pregnancy Promise Program connects individuals to prenatal and postnatal care, other physical and mental health care, treatment for opioid use disorder. The Pregnancy Promise Program provides support during the prenatal period for up to 12 months after the end of pregnancy. Next slide, please. Transitions of care. We have a transitions of care team that is a multidisciplinary care team of nurses, social workers, and community health workers that assist individuals to transition home after a hospitalization due to a medical or behavioral health diagnosis. If the member is assigned to a case manager, that case manager would assist in that member's transition. Our Transitions of Care program is fully aligned with the Coleman model, which has the 4 pillars, consisting of making sure that the member has their discharge summary to include and to take with them their follow-up appointments and to make that part of their patient health record, making sure that they have their follow-up appointments with their primary care physician or specialist, educating members and recognizing red flags or warning signs to report to providers to reduce hospital readmissions, and then also making sure that they've been able to obtain their medications, understand how to take their medications accordingly. Next slide, please. So this brochure that you're looking at it speaks to some of the rewards that we offer our members This specific reward is for individuals who with an SUD diagnosis who are engaged in or in attending intensive outpatient programming. They can receive up to $10 per session that they attend. And this is for Healthy Indiana Plan members. It's up to $100 per year. And so next slide, please. So this here is also a brochure that speaks to our rewards as well. Just highlighting that each member can receive up to a maximum of $300 per year per member in rewards. And members can contact member services or access their online My Health account to see which activities make them eligible for a reward. Members can receive rewards for preventative care like a flu shot, COVID-19 vaccination, and physical exams, just to name a few health promoting activities. So now I'd like to hand it over to Gail, who's going to speak a little further about some of our additional resources.
Thank you, Emma. This is one of the social determinants of health that has impacted our members is transportation to appointments. CareSource provides unlimited transportation to and from medical, mental health, dental, vision, just about any service that's going to be covered under their insurance that's going to be available to them. So members need to call our transportation benefit manager 48 hours prior to that appointment to arrange transportation. And just to put a note, if they have an appointment on Monday, they need to call by Thursday because the weekends don't count because that call center is closed on the weekends. So during the public health emergency, CareSource decided to provide rides to our members to pick up groceries from a local food pantry or curbside pick up groceries. And we've decided to continue that benefit. The member still needs to call our transportation vendor 2 days in advance and let them know that they need a food ride for this service. And then the members can utilize this benefit up to 5 times a month. So health-related social needs are found where people live, learn, work, and socialize. They impact our members' access to healthcare and health outcomes. Our teams are aware of these impacts of social determinants of health and access and assess our members' needs on a regular basis. We have what's called our Life Services Department that we're going to specifically address our members' social determinants of health. And so if you go ahead and go to the next slide, this is one of the life services programs that CareSource offers that I like to highlight. It's our Job Connect program, which was one of the programs that individuals who fill out the pre-survey said they wanted to know more information about. CareSource is the only managed care entity that has a Job Connect program that works with our members in trying to find employment, and sometimes it could be better employment, which helps them become self-sufficient. We try to find jobs for our members who are earning at least $10 or more an hour and with benefits, as this is what is needed for these members to sustain self-sufficiency in the community. We have over 6,200 members that have been involved in the Life Services program. We have over 192 employer partners that are willing to work with our members. And some of these employers are felony-friendly employers. And then we have about 71% of our members who have participated in this program have retained employment. Our members can also work with the job coach for up to 2 years. Even if they no longer have CareSource in that 2-year period, they can still work with our job coach. Next slide. Another program that CareSource is the only managed care entity that has this program. It's called our Reentry Program. Initially, we started out as a pilot program with 2 identified correctional facilities. We provided face-to-face engagement services to the offenders by providing group education as well as meeting them with them individually. We're now in 15 of the correctional facilities in the state of Indiana, but due to COVID, we had to scale back that and do some virtual pre-release classes to educate the members on their Medicaid benefits upon release. We have recently resumed going back into a couple of the facilities at this time, so that's exciting for them. We also have added some enhanced benefits to the reentry program, where our members can receive some financial assistance with expungement and driver's license reinstatement fees for the members who qualify. So, of course, there's some exclusions that may apply depending on their legal offense and the past driving record. But the member needs to be engaged in either our life service program, the reentry program, or our care management program. And so this final program, that of course we're the only managed care entity that has this program still, is our youth reentry program. And this too is a pilot program right now. We have partnered with Pendleton Correctional Facility to assist those youth who are returning back to their homes in communities and to provide them with the additional support they need during this transition. So the behavioral health team here at CareSource, we have staff available to provide the following trainings to our providers and community partners. We have Preventure, Youth Mental Health First Aid, Mental Health First Aid, and QPR. Preventure is an evidence-based prevention program that uses personality targeted interventions to promote mental health and delay youth substance use, and is developed for ages 12 to 17. And this program can be implemented either in the school setting or outside the school setting with online availability. So I'm now going to turn this back over to Brittany, who's going to provide you with some more information on our community learning collaborative and open it up for discussions if time permits. So Brittany.
All right, thanks, Gail. And so just wanted to display a flyer about our community learning collaboratives. We've discussed them a little bit throughout the presentation. And so hosting a community learning collaborative is just one way we can help. Our goal with these is really to come along providers and community so we can facilitate a discussion about any gaps and ways to increase community supports. And just last year, for example, we did host a community learning collaborative in Lawrence County, and we focused on ASAM levels of care and bringing 3.1 residential to the area, how to make that a reality. And so if you're interested in having us come speak to your coalition or program or in partnering with us, please let us know. We will be sending a post survey that follows this presentation. We'll also have our contact information on the last slide, so you can reach out to any one of us on the CareSource team to discuss partnership opportunities. So just wrapping up here, again, we want to help to improve any collaboration between our organization and the many councils across the state. We want to ensure that best services and resources for our members are in place. And so again, our contact information will be on the next slide, and we'd love to talk more about working intentionally together. So please let us know. And thank you so much for having us here today. So I just wanted to mention that we have a post survey following today's presentation. So be sure to offer feedback on how we can make this better, and let us know if you'd like us to present to your agency or coalition in the future. So at this time, I don't know if we have time for questions, but did just want to throw that out there. We'd be happy to have a discussion or clarify anything that we talked about today.
Yes, does anyone have any questions? And if you don't have access or not comfortable talking, you can always put it in the chat.
Hi, yes, my name's Robin Vita. I'm with the St. Joseph County Department of Health, and I just clarifying question. CareSource has regional folks, or how would I, as a local county, like who would I be looking for to connect with?
So St. Joe County, I believe that's in the northern part of the state. Am I right?
Yep.
Saying?
Yep.
Okay. So Gail is the representative for the northern region. Any of us can get you to the right contact. But yes, we have regionally based staff and we are statewide. So
Okay.
any coalition we can.
Perfect. Thank you.
Mm-hmm.
Any other questions?
Do you have a one pager or somewhere we can go with just brief information for all the things that you talked about today that we can share with our members?
We do.
Because it was great. You shared a lot of stuff and it was all really great. And I would love to share it with my members here in my county.
Great. Yes, we do. We have a couple approved documents. So we'll look through those and get Kimbra some that we think are appropriate that can sum up all that we went over today.
Yes, and there was a question in the chat that membership was talked about often. How does organizations become members? It seems that people, HIP insurance can become members. Is that correct?
That is right. So our members are those that are accessing our health plans. We are the insurer or the managed care entity. But with that, we actively support our providers and community partners because we know the work that you all are doing with our members is important. That's what helps them on their road to recovery. So we try and support our providers and community partners with any trainings and letting them know of all the programs we have available so that our members can get connected.
I hope that answered that question. And there's been a couple questions about the slides. Those will be on the website within the week that you'll be able to access, as well as the recording of the presentation, which was fantastic. Thank you all very much.
Thank you for having us. We really appreciate it. And again, if anybody would like us to come speak, we'd be more than happy to arrange another presentation.
Great. All right, I'm going to turn it over to Sadia from ICJI at this time. Welcome, Sadia.
Good afternoon, everyone. I have only 4 things on my list today. First, I would like to inform you all about the status of current operational LCCs. We had 87 LCCs who were fully functional in 2021. The number of operational LCCs have increased this year, and I'm happy to share that now we have 90 LCCs who are fully operational across the state of Indiana. By that, it means that all 90 LCCs have obtained ICJI approval to use DFC funds to provide prevention, treatment, and the criminal justice services at local level. The LCCs which have resumed their operations in 2022 are Crawford County, Switzerland County, and the Wabash County LCCs. The next thing I want to talk about is the end of the year report feedback. The end of the year report review is completed. Program managers are currently in process of sending end of the year report feedback. If you have not received the feedback yet, you will get it in the next few days from your own program manager. The third thing I want to talk about is the first quarterly report submission. So as I mentioned that there are 90 operational LCCs, out of which we have received 85 first quarterly reports. Those who have not submitted their PR1 must have received an email from their program manager with a due date. Please make sure that you will submit your first quarterly report in the IntelliGrants by the requested date. And the last thing I want to talk about is training and funding opportunities. We have been sending emails to include various funding, conference, and the training opportunities. I would strongly encourage you guys to keep an eye on those emails. and apply to any trainings that have been offered by Great Lake Transport Technology, because I feel that those are beneficial for your LCCs, and you can bring some resources for your counties. And that's all what I have. If anybody have a question, I'm happy to answer it.
All right. Does anyone have any questions for Sadia? All right. Well, we are just a couple minutes past 12:45. So if anybody would like to stay on or have some questions for the Indiana Coalition Network, please stay on. But we do appreciate the presentation and all of you joining us today. So thank you and have a great rest of your day.